So one of the things that we probably didn't delve as much into because we were obsessed with 24-hour challenges in our full podcast was the piece that you mentioned about helping cancer patients at the moment with their pre-habilitation, you call it. Just tell me a little bit about that and how that came about and why that matters to you and what it's achieving.
Well, I think the first place to start is to remember that exercise is medicine. And I think it's a really important phrase to keep with you all the time. Exercise is medicine. We as humans have evolved to move. And when we move, it has a fundamentally positive effect on both physical health, mental health, emotional health. And crucially, one of the things that we don't talk about very much is social health. And if you look at that, that is effectively the definition, the World Health Organization definition of health. It's not just about the freedom from disease. It's also about mental, emotional, and social health. So exercise is medicine across all of that. And what we've seen, an awful lot in recent times, particularly since lockdown, is the role that physical activity plays in mental and emotional health. And that is true for everybody. Nobody is devoid of that. And I think certainly, where I came from an elite athlete background, obviously. But I did my PhD at St. George's Hospital Medical School in effectively what was sudden cardiac death in young athletes. So it was a cardiovascular specialist. And then I set up a clinic. We did some work with the British Olympic Medical Centre, the English Institute of Sport. But then I set up a clinic in Harley Street in London. And what we did is effectively translate all of that work into the clinical population. So the fact is that exercise is medicine also applies for people who have pre-existing disease. So we know that exercise will reduce the risk of developing disease, things like type 2 diabetes or heart disease or cancer, in fact. And as part of that process of developing exercise interventions for disease, there's sort of this, I would say it's relatively new. It is relatively new. This idea that actually exercise in cancer patients is really a very important step forward. Initially, because what exercise does is it reduces the negative side effects of chemotherapy and radiotherapy, things like myalgia, so muscle aches, things like poor quality sleep, lots of different factors. And so from there, what we then developed is this idea that if that is the case, then what we could do is actually implement exercise, what we call peri-oncology, so during treatment, whilst people are receiving chemotherapy. And there have been some studies in animals in particular, but there's also some other studies in other cancers, so things like breast cancer. We did some work in that. But our most recent work is in this cancer called esophageal cancer. And what we did with the team at St Thomas's and down at the Medway in Kent is we created a study that we published last year, where we did exercise intervention during chemotherapy, and the results were truly outstanding. I mean, just incredible. So just to give you a little snapshot of it, if you exercise during chemotherapy, what we found was you got a greater reduction in tumor size. So the tumor got smaller. A smaller tumor is easier to resect at surgery. When we take a look at cancer cells inside that tumor, what we see is we have an incredibly positive effect from exercise peri-oncology. And then some of the other critical factors are actually around physical capacity. So what we found was we could actually reduce the drop in aerobic capacity. We could reduce the loss of muscle mass. And so therefore what we do is we maintain functional capacity. Add on top of that, you get improved psychological input because patients now feel that they've got something to hold on to. They're actually doing something very positive about it. And what we did is we measured what's called health-related quality of life. And what we showed is a significant improvement in health-related quality of life in patients that undertook the exercise. And then more latterly, in fact, a paper we published just very recently, we took a look at those patients who didn't want to take part, lots of reasons why they didn't want to take part, or they dropped out. And what we saw is actually the survival curves between the two was significant, is that if you exercise during chemotherapy, you were likely to survive for longer. So the outcome was truly outstanding. And most of the work that we're currently doing now with a group of national and international experts is we're trying to get that work now into what we call standard care inside the NHS, such that actually every cancer patient, irrespective of what the cancer is, that during treatment they can access physical activity, pre-habilitation. We call it pre-habilitation because it's prior to surgery. And so we're working very hard to try and get that as standard of care for everybody, because we know the positive impact it can have.
Does that happen with infection rates as well? So if people are partaking in exercise over the course of their cancer treatment, if they are exercising, does that help them ward off? Because immunity is such a major issue, isn't it, with chemo? And I know this from my own personal experience with my mum, who had a round or several rounds of chemotherapy and had neutropenic sepsis 4 times. So we were constantly rushing back into hospital with spiking temperatures. And does exercise contribute to reducing the inflammation and helping the immune system as well during treatment?
I love those questions.
Good, excellent.
You can be part of listen, you can be part of the research team. So interesting enough, the paper that we're currently writing off the back of that study, the paper we're currently writing is exactly in those 2 areas. There's one around immune function, and the other is around inflammation. And I mean, it's quite complex what we're looking at and how we're measuring it. But what we are showing really very nicely is that actually what you do is you reduce inflammation and you enhance. And to some extent, what you don't do is get an improvement in immune function. But what, as you've just described nicely, is you get a blunting of immune function with chemotherapy. What we're able to do is maintain immune function. So without any shadow of doubt, the susceptibility to infection will be reduced because you've got a sustained or maintained immune function with a lower inflammatory environment. So there are lots of positives to be sought from for what exercise is medicine is a very simple, very cheap intervention, and is something that everybody can do. So just to coin it, often people think, well, if we're talking about exercise, that means I've got to buy spandex and become a member of an expensive gym. Absolutely untrue. What the exercise that we prescribe, and we've done this in multiple studies, is effectively just the WHO guideline on physical activity for health, which is 150 minutes of moderate intensity physical activity per week. It's effectively 30 minutes of walking, brisk walking every day of the week, and then 2 strength sessions to work on muscle mass and strength. So it's something that you can easily be delivered, you can easily do. And what's great now is that there's lots of centres now opening up around the country, and work that I've just finished with colleagues of mine, and we were presenting that work last week actually at a conference around what's called clinical exercise physiology. So we spent the past 3 years developing personnel to actually deliver these type of programs, and we've created a new healthcare professional, which is a clinical exercise physiologist. So it's somebody that can prescribe exercise to clinical populations to ensure that it's done safely and appropriately to optimize outcome.
I love that. Greg, thank you so much. That's so interesting. Found that really fascinating. And I'm glad I asked the right questions. Just a little bit of knowledge is dangerous, isn't it? Just a little bit of knowledge can be a little bit dangerous.
But yours was good, so that's fine.
I pass. Brilliant. I pass. Excellent.
You passed.